When I was a first year resident, Ray was the most junior consultant at GS1 at that time. He was very approachable, whether we discussed personal and academic matters at that time.
Say na I'm so grateful sa mga tinuro mo sa akin, mga surgical techniques na lalo na yung knife dissection na tinuro mo sa amin noon na ina-apply ko pa rin.
So surgeries were often done during Mondays and Fridays, the days we call as altangkap days, meaning we eat our lunch, breakfast, and dinner during the day in just one meal. So that's surgery that we do starting from sunrise even to late evening.
Siya ang isang consultant na masasabi ko, he is one of the best mentor I've ever met. Kasi siya concerned sa mga residents at saka napansin ko very sincere siya magturo sa mga residents niya.
Dr. ROJoson, his name is synonymous to surgical education.
You are, I think, the epitome of a PGH surgeon, being very meticulous in your dealing with your patient, handling a case, teaching the residents from the junior to the senior resident.
A great impression of you when you were a new consultant here at PGH. You operated with such great surgical finesse on so many difficult cases, and no matter how awkward the position of the patient was, you never complained or said anything bad. And this taught me a lesson on being composed in the during surgery.
In behalf of the cardiothoracic surgeons, I would like to thank Dr. ROJoson. I'm sure majority of us trained under him during our general surgery years, and I remember him as a very dedicated teacher. And I remember having read his book on thyroid diseases, and it was like a sort of a requirement before we can do our first thyroidectomy. So again, thank you very much, Dr. ROJoson, and we wish you luck and more power in your other endeavors after retiring from PGH.
Na-realize ko lang when I'm already teaching students, teaching residents, the way you taught us how to teach surgery has been with me, sir, for all these years.
Yun nga, yung mga librong ginawa mo doon, yung mga techniques ng neck dissection, may copy ako ng libro yung lagi ko pa rin ginagamit yun, nire-refer pag may ginagawa ko mga neck dissection.
Siya ang isang naging inspiration ko nung nasa residency training ako. Kung ano man ako ngayon, malaking bahagi siya.
Most recent memory of you was maybe just a few weeks ago when you told me something, and it goes like this: when there's a will, there's a way. Meaning, you're never too old to learn a new skill. I was asking this because you were inviting both young and old consultants to not only for a master's degree but for a PhD degree.
I remember the GS1 conferences, though it can take as long as 8 p.m. We learned a lot during those days, especially on your approach, your algorithms, particularly for thyroid diseases. You have the most cost-effective approach for thyroid and breast diseases that you have taught us.
I have this little incident, sir, na gusto ko lang i-remind kayo. During one of the GS1 conferences, when I went to the board, may sinabi ka sa akin, sir, how can you become a good surgeon if you can't even draw properly? Well, sir, you taught me well. I'll become a good surgeon, pero bano pa naman ako mag-draw. Again, sir, thank you for all the things you taught us.